There's a lot we still don't know about COVID-19. However, we're learning more and more every day. What do we know? Well, we know that it's highly contagious, and we know that it is spread through droplets. Droplets from the mouth, droplets from the nose. What does that mean in terms of your risk of contracting COVID-19? It means that you need to be in the same general area, that is within 6 feet of somebody when they cough or sneeze and you inhale the virus. Or it means that somebody has coughed or sneezed, touched their hands to their mouth, put their hand down on something, and soon thereafter you put your hand down on it and touch your hand to your mouth. So what we know now is that the precautions that we need to take to prevent the rapid spread of COVID-19 remain the same. Wash your hands frequently, and if you don't have access to hot soap and water, use a hand sanitizer with 60% alcohol. Don't touch your face. Keep your hands below your waist. That will help to remind you not to reach up and touch your mouth, touch your nose, touch your eyes, and disinfect often. What we have also learned, however, is there's some additional steps that we need to take, and particularly some additional steps for older adults. In many communities in the United States right now, there is wide community spread of COVID-19. What that means is that we need to start practicing social distancing. What is social distancing? Social distancing means that when you're outside, out and about, it means staying 6 feet away from the nearest person. It means limiting the number of visitors that come into your home and your apartment so that we prevent the opportunity to pass COVID-19 from one person to many more. It means not going out to bars and restaurants and being in large crowds. And indeed, the Center for Disease Control has now recommended that crowds be no greater than 10 people. It means special precautions for older adults, and these are particularly hard. It means older adults should severely restrict the number of people that are visiting them and coming into their apartment. And it means that they should not have children, grandchildren, even young adults frequently or visiting at all. It means that they should go out only when they can be assured that they can practice social distancing, and if at all possible, should avoid going out to grocery stores, riding public transportation, or going out for meals or religious services. It means staying home as much as possible. This is hard. And one of the things that many people worry about, including me, is the effect of isolation on older adults and the risk of depression. What can we do to prevent that from happening? First of all, for older adults who are self-distancing or self-isolating in their homes, call them frequently. And don't just talk about COVID-19, talk about normal things. Have different people call so it's not all the same person. Use video conferencing, video calls wherever possible so that grandparents can see their grandchildren, talk to their grandchildren, hear what's going on in their lives. Stream movies, other shows. Watch TV, but try not to focus on the news. When we are exposed to minute-by-minute coverage of COVID-19, it can really increase our anxiety. Don't isolate yourself from what's going on, but check in just a couple times a day as to what's happening both in the United States, your community, and the world, but then turn to something else. And then finally, watch for signs of depression and be ready to act on them. And it's important to realize that depression presents differently in older adults. Older adults often don't experience sadness. What they experience is loss of appetite, weight loss, difficulty sleeping, tiredness and fatigue, and sometimes memory problems. And these are the things that both adult children and their parents should be watching for and self-monitoring. And if any of these develop, that's the time to call your doctor right away so an intervention can be made, treatment can be started before things progress. It's important to call your doctor, or if you're the child of somebody who sounds depressed, call your doctor and let them know what's going on so we can start treatment right away. One of the questions that one of my patients asked me is, what can I do to boost up my immunity so that I'm at less risk for developing COVID-19? We wish we could tell you that there was a magic pill that you could take that would rapidly boost up your immune system. Unfortunately, we just don't have such a pill. And however, there are things that you can do. Make sure you're getting enough rest and sleep. Eat well. Make sure you have access to food. Stay well hydrated. Make sure that you're drinking so you don't get dehydrated. Exercise, and this becomes hard in the setting of social distancing, but there are things you can do. If you have a stationary bike or a treadmill, use those in your home or apartment. Go out for walks when people are not around. Take long walks out in the community, out in the park. Just ensure that you stay 6 feet away from the nearest person. And finally, do everything you can to minimize your own stress and anxiety in this very worrisome time. Steps that you can take to do that are, 1, limit your time on social media, and particularly limit the time you're focusing on COVID-19 on social media. There's a lot of misinformation out there, and there's a lot of very, very scary posts. Keep up to date on what's happening from the data. Look at the CDC, the Center for Disease Control website, the WHO website, the World Health Organization website, the Mount Sinai website, and your local newspaper and one of the reputable national newspapers or television news shows. Limit how much you watch COVID-19 on TV. Try and keep it to twice a day. There is nothing that's going to happen between, say, 9 a.m. and 5 p.m. that you're going to need to respond to immediately, and that won't be there at 5 o'clock when you turn on the television. And finally, what I would recommend for older adults is that they have in their house and apartment a 30-day supply of food, of other essential items, and that's a 30-day supply, not a 6-month supply of toilet paper, and a 30-day supply of their medication. I think we all recognize that this situation is really hard, that we as a community, we as a country, we as the world have not gone through a crisis like this at this scale in our lifetime. We will get through this. We know what to do to control COVID-19. If we all act responsibly, wash our hands, don't touch our faces, keep our hands below our waists, disinfect everything, practice social distancing, don't go out in crowds. We will get through this, and we will get through this well. I think it is important for all of us to remember that there will be an end to this, and we will go forward, we will pick up the pieces, and we will go on with our lives.